Hi, Dr. Josh Bureau here with Mountain View Chiropractic, and I'd like to welcome you back to our video blog series. Something we're going to talk about today, which is vitally important, and we've just seen a lot of it in my practice here over the past several months, is cholesterol and the myth behind what cholesterol is, what it does for your body, and this whole class of drugs out there which are called statin drugs, which are designed to lower your cholesterol. So the question I always ask everybody is, when did cholesterol become such a vile substance that we have to lower it to such a low level? And a lot of times people don't even know what cholesterol does in our body. So a couple of major things I want everybody to know is that number one, cholesterol is designed to make every single cell in your body. So every cell in your body needs cholesterol to form the cell membranes. Also, most of your neurological function in your brain is made up of cholesterol and essential fatty acids. The other thing that it does is it makes a precursor to all of the stress hormones in your body, from cortisol to estrogen and all of your stress and sex-based hormones. And it also is the precursor to vitamin D in your body. And we all know how important vitamin D is for our body and for our overall function. And what we look at now is when people go into their physicians, they'll take a look, a printout of all their blood work, and they'll see that their cholesterol level is a little bit outside of normal. It's higher than the normative level. So what happens next usually is the doctor prescribes that person a certain medication to artificially lower that cholesterol. But a better question to ask would be, why is my cholesterol high in the first place? And your body is an intelligent system. 100% of the time, your body's intelligent. So the reason why your cholesterol is elevated to a certain level is because of the allostatic load that your body has. Because of the stressors that your body's in, the stressful environment that your body's in, that's the reason why your cholesterol is elevated in the first place. So if we artificially lower that cholesterol with taking a certain medication, it's not going to fix the underlying cause of the problem, which is our stressful environment. So whether it's the fact that we're not eating right, we're eating the wrong diet, we're not exercising correctly or at all, or we're having toxic mental thoughts where your body needs more stress-based hormones as well. So if we're not eating right, if we're not thinking right, if we're not exercising right, those things are leading us to have an increased stress level to our body, and our body's calling for more cholesterol to function properly. So to artificially lower that cholesterol level without fixing the cause of the problem is just akin to taking a piece of black tape and putting over a check engine light in your car. If a check engine light comes on in your car, you would never think of masking that by putting a piece of black tape over it. You would take it to somebody that could find out what the problem with it is and get that problem fixed. So that's what we do here at Mountain View Chiropractic. We're not going to just mask your symptom with a drug. We're going to do a lifestyle intervention to clean up your lifestyle to help teach you properly how to eat the right foods, how to exercise properly, have the proper mental attitude, and getting the proper adjustments for your spine structurally. And the last thing that I would tell you is that if you know anybody that's currently taking a statin medication, one of the biggest side effects, and something I see all the time in my practice, is rhabdomyolysis. It's a big fancy word that means severe muscle pain. So when you're taking a statin drug, it will absolutely lower your cholesterol because it cleaves the cholesterol molecule. But in doing so, it also gets rid of CoQ10 in your body, coenzyme Q10. It depletes that source. And coenzyme Q10 is vitally important for the production of ATP in your body. And ATP is what makes your muscles run, what makes them strong. It's the power pack in our body. And the biggest muscle in our body and the strongest muscle in your body is our heart muscle. So after years of being on statin drugs, it'll give you a lot of deep pain in the muscles and in the joints, and eventually it'll start to attack the heart and cause heart failure. So if you do know anybody that's taking a cholesterol medication, please pass this video blog on to them and let them know there are other options besides taking that medication. And just the number one class of drug in America, number one selling drug in America for that class of statin drugs is called Lipitor. There's over 26 million people just on that drug. And if we continue to artificially lower these cholesterol levels to such dangerously low levels, it affects our body's health on a global level, and it really affects our neurological level, causes depression, lack of vitamin D in our body, lack of stress-based hormones. So God gave us cholesterol for a reason, and it needs to be there for a reason. So in the future, instead of taking a symptom, or excuse me, taking a drug to mask a symptom, let's look at cleaning up your environment and helping your body live a genetically congruent lifestyle so it will express optimal health. So I hope this has been beneficial to you. Thanks for everybody who's tuned into our video blogs. If you know somebody that can benefit from it, please pass it on. If you'd like to hear more about our interventions here at this office on a nutritional basis to help you along your journey towards health, you can call Lisa at our office at 605-791-4030, or you can log on to our website at www.mtviewchiro.com. Thanks, have an inspired day, and remember to start filling your wellness count up each and every day.